Joining me this evening is Southern Africa Alcohol Policy Alliance Executive Director Maurice Smithers to give us more on this story. Maurice, good to see you and thanks for your time. Now, your body has been lobbying for responsible drinking for a while now. Take us through why this has been and, of course, acknowledging the President's spate of concern of youth drinking.
Thank you. Yes. Let me start off by saying that we don't actually call for responsible drinking. And the reason why we don't is because that's the narrative of the liquor industry. And in calling for responsible drinking, what they do is put the responsibility for alcohol-related problems onto the individual rather than looking at the structural drivers in society that cause people to drink in a harmful way. And in fact, in so doing, they try to shift responsibility away from themselves. And this is a very important point to be made in the case of the tragic Inyobeni tavern incident where 21 young people died. Because for us, the issue is not really only about underage drinking. It's about the general legislative environment in which we find ourselves, which doesn't actually do enough to protect people from alcohol-related harm. So the incident in Inyobeni and the reality of teenage drinking is merely a symptom of a much deeper malaise that exists in the country that can actually really only be addressed by effective legislation implemented from government on the one hand, and on the other hand is the empowerment of people within communities to have a meaningful say over when, where, and how alcohol is sold in their communities.
You know, Maurice, you've kind of stretched it now for us. So you say it goes beyond the youth, and also you've also painted a picture that it's also gone beyond saying drink responsibly, because that's the catchphrase of those who are in the business. Now, do you think your alliance will be able to, curb the drinking culture, not only among youth, but everyone in your country?
Well, there's no reason why we shouldn't be able to, as a country. By way of example, Russia, which is a country which has also had quite significant drinking challenges. I think they're also known as a heavy drinking nation, mainly preferring to drink vodka. Over the last 10 to 20 years, they have managed to reduce alcohol consumption by 43%, and in so doing have actually increased the life expectancy in Russia by 10 years. So, and how did they do that? They did that through various legislative measures, including things like addressing the availability of alcohol and increasing the price of alcohol. And these are suggestions that come from the World Health Organization in their global strategy to reduce the harmful use of alcohol of 2010. And there they argued that the three key things you have to do is to limit or ban alcohol advertising, to reduce availability of alcohol, and to increase the cost of alcohol. And again, if we talk about Inyobeni, it's advertising, it's poor adult modeling, and it's peer pressure that actually have encouraged these young children to go and celebrate the beginning of their school holidays at a tavern. Somebody as young as 13 decided that that was the best way for them to celebrate the beginning of their school holidays. Now you have to ask yourself, where does that come from? And the only place that can come from is from society at large. It's a messaging that these young children are getting from society at large, which is that alcohol is a normal part of life, and that you can only celebrate something, a birthday, beginning of school holidays, anything else, by drinking alcohol. And that's really at the heart of what the problem is. we have to develop a strategy for helping people to understand that alcohol is a dangerous drug, that it can be
and
consumed.
Maurice, allow me jump in here. Apologies for butting in. Now, in developing that strategy, do you think that would have been easier for you on your alliance if your lobbying has been approved, talking about the Liquor Amendment Bill?
Yeah, absolutely. In fact, I must tell you that from 2010 to 2017, we were very much on track towards reducing alcohol-related harm in South Africa, because in 2010 we had adopted the World Health Organization global strategy. There was an attempt to ban advertising in 2013 by the Department of Health. That failed, unfortunately, due to pressure from the business sector. But by 2016, the Department of Trade and Industry had in fact presented to Cabinet a new liquor policy based on the World Health Organization global strategy. That was adopted by Parliament, and the Liquor Amendment Bill was then drafted to give effect to that policy. And we believe that had that Liquor Amendment Bill been passed in 2016, 2017, as it should have been, we may well not be facing the challenges that we are facing today. We may, in fact, even not have had to ban alcohol during COVID, as we had to. As you know, that we were one of the few countries in the world that banned alcohol altogether. So we absolutely, look, the Liquor Amendment Bill is not a silver bullet. It's not going to solve the problem overnight. We believe that it's probably going to take a generation or two for a meaningful reduction in alcohol-related harm. But we have to start, and we have to start now, because of the length of time it will take to effect real change. And we